Imagine a rare cancer so stealthy it masquerades as more common conditions, slipping through the cracks of even the most advanced diagnostic tools. Sellar Chondrosarcomas, a type of bone cancer that grows in the cartilage, fit this description perfectly. But here's where it gets controversial. Despite being one of the most aggressive tumors in the skull, these cancers are often misdiagnosed as benign or less severe conditions like pituitary adenomas. And this is the part most people miss. The treatment approach can vary drastically depending on whether the tumor is correctly identified. A recent study published in the Chinese Neurological Journal on 26 June 2025 sheds light on this medical enigma, offering insights that could reshape how clinicians approach these elusive tumors. Let's dive into the details and ask whether the medical community is underestimating the risks of delayed diagnosis. Sellar chondrosarcomas are a rare subset of chondrosarcomas, a group of cancers that originate in cartilage. These tumors develop in the sellar region, a small but critical area at the base of the skull where the pituitary gland resides. While chondrosarcomas themselves are uncommon, sellar variants are even rarer, accounting for just 0.2% of all skull tumors. Historically, the go-to treatment for these tumors has been open craniotomy, a procedure involving a large incision in the skull. However, advancements in minimally invasive techniques have shifted the paradigm. Enter endonasal endoscopic surgery, EEA, a procedure where surgeons use a thin, flexible endoscope inserted through the nose to visualize and remove the tumor. This approach has gained traction for its reduced recovery time and lower risk of complications. The study in question, led by Professor Songbei Gui from Beijing Tiantan Hospital, evaluated the effectiveness of EEA in treating sellar chondrosarcomas. The team analyzed 4 new cases and combined them with 8 previously reported cases from the literature. Among the 12 patients, with a median age of 28.5 years, the most common symptoms were blurred vision, affecting 2/3 of patients, and headaches, half of the group. A third also experienced hormonal imbalances, which resolved after surgery. But here's the twist. Only 1 patient was correctly diagnosed before surgery. The rest were initially labeled as having chordomas, invasive non-functioning pituitary adenomas, or craniopharyngiomas. This highlights a critical gap in preoperative diagnostic accuracy. So, how can clinicians improve detection? The researchers emphasize the importance of integrating imaging and clinical data. For instance, MRI scans showing heterogeneous enhancement, mixed signal intensity within the tumor, and no diffusion restriction, indicating free water movement in tissues, are red flags. CT scans, meanwhile, should flag bony destruction and tumor bone attachment. Professor Gu explains, if a patient presents with a calcified sellar mass and normal or slightly impaired pituitary function, chondrosarcoma should be the first suspect. The pituitary gland, which regulates hormones like TSH and prolactin, often remains functional in these cases, unlike in other sellar tumors where hormone production is typically disrupted. Treatment outcomes were mixed. Only 7 of the 12 patients achieved complete tumor removal, while 5 had residual disease. Professor Gu stresses that while complete resection is ideal, adjuvant radiotherapy is crucial for those with leftover tumor tissue or a high risk of recurrence. Post-operative radiotherapy isn't just an option. It's a necessity for long-term survival, he argues. But should we be pushing for more aggressive upfront treatments, even if it means higher surgical risks? This raises a provocative question. Is the medical community underestimating the role of early aggressive intervention in these cases? This study is a wake-up call. Sellar chondrosarcomas are not just rare. They're a diagnostic and therapeutic challenge that demands a multidisciplinary approach. For patients and clinicians alike, the takeaway is clear. Early and accurate diagnosis combined with tailored treatment strategies could be the difference between a full recovery and a life-altering prognosis. What do you think? Are we doing enough to prioritize advanced imaging and specialized surgical techniques for these rare but dangerous tumors? Share your thoughts in the comments below.